Okay, hello everyone. We will give 5 minutes so people keep joining the webinar and then we will start. Just to let you know, you have the chat available in case you have any questions. And thank you for joining.
So thank you very much, Anais, for welcoming the participants. What we are going to do is that Anais will first start with the housekeeping rules. Then I will start with the main presentation, and then we'll start with the question and answer. I hope that there are a lot of questions, not because I haven't explained well what I said, but rather because we can go deeper into the topics that really are of your interest. Just to give some context, we have been working on these demand-driven innovation approaches for over one year, 12 months. The PREPARE project is an European Innovation Ecosystems project for those that are very versed into what I call Brazilians. We have come together several regions to work on how to implement demand-driven co-creation. And this is the topic. Basically, what I want to do is to encourage you to participate. You can interrupt me anytime. If I don't see that because I will have my presentation open, I will ask my colleagues to let me know. I don't know if they have, do they have the microphone open all the time, Anais, or do they
No.
have to raise their hand?
So just to let you know, you will have the Q&A box available to write your questions or comments. Your microphone will be muted, but we can open when you want to talk. And this webinar will be recorded, and the recording we will share with you in an email after the webinar. And lastly, if you want to, you can follow us on social media and LinkedIn in Prepare for Innovation. So,
right. And I think I'm going to start because
yes.
I don't want to abuse people's time. So let me take over the presentation. Please confirm that you can see that. Everybody can see that?
Yes.
Excellent. So my name is Jorge González. I'm the director of Tipiomed. We are a non-for-profit association located in Spain. We are the coordinator of the project Prepare. And basically from Tipiomed, we promote innovation across Europe, especially the demand-driven one. We will get into the details right now. So why are we here? We want to increase the regional competitiveness by solving innovation challenges of local public entities that become business opportunities for small and medium enterprises. Okay, this is the objective. Maybe you don't know what each of these words mean, but we will go through them. And again, please feel free to make any questions anytime. And of course, we will have a Q&A after my presentation. But please interrupt me if you want to have contextual answers. So there are two types of innovation. We have referred to demand-driven innovation. I guess that everybody knows what open innovation is. It is basically when you don't do the innovation within your own premises, only yourself. Open innovation is that you engage with other organizations to produce innovation. And for that, you have two types of open innovation. One is the technology push. That is one, for example, a company, say a provider of solutions, they have or they are developing a solution and they want to engage with a potential customer to improve that solution. But the origin of the innovation starts with the private company. That's what is called technology push. Demand-driven is the opposite. It's when you start with the demand, right? Let me get into more details about it. What do we mean by demand-driven innovation? We start with the identification of one need, okay? One need can be, okay, for example, of unmet needs that we have identified is, for example, what we call the digital card of pregnant mothers. Okay, the ones that what happened is that these women that they were pregnant, they have to interact with different doctors and nurses across the regional healthcare system. And then what happened is that they had to take on paper the data from one to the others. So they say, what about if we create a digital space where this information can be exchanged naturally? So it is not the mother to be that brings that information to each of the healthcare professionals. Okay, it is all centralized in one system. Another example was, for example, to create patients with epilepsy, they need to go to the neurologist. Thing is that when they go to the first visit, they schedule the visit every 6 months, for example, because they don't know when is that they are going to be needed. So what happens is that some of the patients, they need to be seen more frequently, and others they don't need to be seen at all, meaning that they don't need to spend one morning and leave work for one morning just to tell them you are okay. So the solution that was created was a kind of WhatsApp, obviously optimized for the context of healthcare, where patient and doctor could exchange information via text, and then for those that needed to come more frequently, then they were appointed, and for those that they need to go to the office, they just skip it to the next iteration. So these are examples of needs that actually were identified by healthcare professionals, and that together with a company, the solution was created. I am mentioning a lot of healthcare examples because we from TPMed, we have a lot of experience in this field, but please, this is completely horizontal. This approach is fit for all areas, okay? Now, we start with identification, for example, of these needs that I mentioned. And what usually happens is like, the question is there already a solution in the market? Or our initial idea, could it be improved? What other people outside the organization can tell us? So usually it is done what is called a market consultation, an open market consultation. And then this need with this feedback gets improved on what we call a challenge. Challenge means that we incorporate information from the market and from other stakeholders in the organization beyond the ones that had identified the need in the first place. Now, this challenge is now ready to be open, publicized. And then the call for suppliers, basically what it does is that ask who is interested. Who of those innovative companies is interested in helping what we call the challenger to solve the problem by creating a selection. So you make this open call, then you select who is your best partner or partners, and then you start with the co-creation of the solution. Then this solution at the end of the project is evaluated, and the logical step is to adopt that solution in order to have an impact. You see here a question mark, we will come back to this later, okay? But this is the typical demand-driven innovation life cycle. Of course, that it can be vary from project to project, but the key thing here is that we start with the demand, with what is the need, and then we involve the solution, and then we work together with them. Now, you may know this graph for those that of you from that you have worked with the European Commission pre-commercial procurement instruments, PCPs, or public procurement of innovative solutions, which is PPI. I'm not going to get into the details, but just to let you know that these projects are usually require millions of euros to be deployed. Usually take between 3 and 4 euros, and they are not very easy to manage. Okay, usually there is a lot of overhead. You see here that there are different phases. You need to evaluate its phases. You need to publish a tender in an official regional publication. Because there's millions of euros, you need to be very careful how to assign the money, etc., etc. So they are very fit for big projects, complex projects, European projects, but what we see is that for regional realities, they are not really fit for purpose. So we have to be very clear that pre-commercial procurement instrument like this on the right from the European Commission is just an option, it's just a kind to implement demand-driven innovation, which is the concept. So we should not confuse what is the concept, the approach of demand-driven with a specific instrument that follows the approach, okay? So we say, okay, pre-commercial procurement perhaps is not really fitting the realities of the regions, is too complex, requires too much funding, and it takes very long. That, for example, for some challenges, especially involving digital, the challenges that I mentioned before, they don't require millions of euros to be deployed. So what can we do? And this is the core of the Prepare project. We want to design demand-driven policies, this demand-driven life cycle that you said before, but adapt it to the realities of the regional context, okay? So how can we get something starting from the need to get a solution, to get with a provider, but in an instrument that is really fitting the realities, the personnel, the funding availability of the regions. Now, why do we want to do this? We want to do this because for the demanders of innovation, that could be a regional healthcare provider. It could be also the regional education department. It could be a city. It could be someone. It could actually be also a big company that has traction. These guys, they have a problem that want to be solved. They want to deliver better services. They want to create better products. They want to serve better to their customers. That could be the citizens in the region, or even other, other consumers, because they are a private demander of innovation. The important thing is that by getting into this approach, they will get, at the end of the day, they will get their unmet need solved, so they can deliver value to the end users. Now, the value for the solvers of innovation is that by identifying that unmet need, this can be a business opportunity. And by tackling this business opportunity, they can create new commercialization pathways that at the end of the day, what done properly, it can generate growth to their organization. They can also basically make the company more competitive, and basically they can be better. Because many times what we see is that some companies, they have great technology, but they focus the technology in a solution that is not really what the market wants. So by starting by the need stated by the customer, they can better link their technological capabilities with the real needs of the customers, knowing that because we have done this open market consultation, that need is not currently covered by the market. Okay, so it's a way to spot business opportunities, and that's the value for the solvers of innovation. Ecosystem players. We at TBMed, for example, are an ecosystem player. We are a cluster. Okay, there are also technological centers. There are universities. There are European business centers. What we can do, and we will see that later, is that we can deliver our know-how, our expertise, our connections, our resources to support that collaboration. Okay, hopefully we will get some money paid to us so we can maintain delivering our services. But the ecosystem players get aligned against the needs identified by the demand innovators, and by doing that delivery of services, they also gain, because it is in their mission and because they also get economic resources to maintain themselves. And then the citizens at the end of the day, they benefit from all of them. They benefit because they will get better services, from, for example, the the regional public administration. The solvers of innovation ideally will generate more quality jobs. They will pay more taxes. Okay, so that will also bring them more opportunities for from the citizens, and the ecosystem players also is a way to leverage the investment that has been done by the region itself. So it's a kind of virtuous circle that everybody wins, and that's the promise. Okay, that by starting the need, everybody wins in the region. Now, I said before that these PCPs, they usually require millions of euros, usually between 3 and 5 millions. This is not something that regions have so much deep pockets, okay? However, they have a funding resource, ERDF, that has some advantages that we'll see now. Also, regions is easier for them to wrap added value services to that money, and they are much closer to the ecosystem that from European or national levels. Let's see them in more detail. Okay. So ERDF, I guess everybody is familiar with ERDF, is the money that regions manage, among other things, to promote innovation. So the advantage of ERDF is that it's available every year, meaning that that's predictable. Okay, you know that this is going to be launched next year. So when you identify, say, one unmet need, even if the call for collecting these unmet needs by is not open, you can put it in your hard disk, you can put it in a drawer, and then when it's the call for unmet needs is open, then you can put it because you know it's going to happen. And because it happens every year, everything that we do 1 year can be leveraged for the next one. For example, all the awareness campaigns, all the capacity building, all the connections, you can leverage for next year and enlarge them next year. And then, because you learn every iteration year after year, you will improve how you do things. You will improve the instrument, you will improve the communication. The instrument and the approach gets better and better after this. So this is one advantage of the region that doesn't have European or national, among other things, because they only is like one shot project. You don't know if when it's going to be the next one. Okay, and all the learnings, if the people change, which is something that usually happens, is lost. Regional level, maybe you have less money, project takes less time, but because you do it every year, at the end of the day, you get much more power out of the initiative and results. Now, a lot of the regions, the agencies in charge of innovation, they deliver other services. For example, business modeling, access to private investors, preparation for European or national public funding. They have commercial representations abroad. So, because also these agencies are smaller and usually more quicker to react, what you can do is that you can easily wrap the money with added value services that they are already available from these regional agencies. Okay, because for some companies, what we have seen is that it is not only the money. The money is nice and it has to be there because people have to pay mortgages. But in order to maximize impact, you need to wrap added value services to that money. Last one is that in a region, because after again, it's a smaller branch, there is usually more frequent communications between the regions that are European level. The communication that the call for unmet needs is open. The communication that the call for recruiting solvers is open. The benefits, exchanges, etc., is much easier. Okay, the closer, the easier. For example, for finding what is the right partner for the unmet need. Okay, and by generating these contacts, for example, during the capacity building, you also generate serendipity that could be leveraged easily in the region that at European level. Okay, and it is always when you two organizations, different organizations, collaborate, there is always the issue of trust, especially at the beginning. It's much easier to do generate trust at regional level, especially when you share the language, when you share the culture, you share the way to do things, than say the European level with two different countries with different languages. Okay, so these three are the advantages of the regional level versus the European level, which makes this approach very attractive to think how can it be implemented. So we say, okay, PCP does not really fit into the realities of the regions, but we still want to have a demand-driven approach. How can we do that? Okay, so this is what we call the prepare approach. Okay, this prepare demand-driven co-creation approach takes into account from the beginning, and is designed from the beginning to take into account which are the resources and what are the resources, both at the financial level and at the human level. Because if you have one person in the innovation agency, the local innovation agency, to devote one person of the staff for 3 years and lock it is too much an investment. The European Commission can do that. The region cannot do that. Okay. So this is an instrument that we had designed in a project that took place several years ago. It's called the in-demand. And let me explain how it works. You will see that it's the same demand-driven concept, but with twists that really fit into the regional realities. Like any demand-driven, we always start with the challenger. Okay, that's the organization that has the unmet need. Now, this organization reports share that unmet need with the organization, the local organization that is going to fund, that is going to put the money on the table for the co-creation. In many regions, this is the Regional Development Agency. In other parts of Europe, for example, in Poland, it's called the Marshall. In other parts or Europe, like the Oulu in Finland, is the town hall who is managing that. Whoever is the organization. That's why we put here roles. We don't put the type of organization, but we put the role of that organization. That in this case is to set up the call for recruiting the solvers and paying them for doing the co-creation. So the funder, what it does is launches a call. There is a selection process, and we only select one. Okay, we only select one company. Is that if you see the other one, it was like a kind of a funnel that we have several companies in phase 1, then less companies because we do a selection, and then in phase 2 and phase 3 we just keep 2. Here we just take one. There are no phases. It's very straightforward. We want to have the leanest approach as possible. So we get to the bare bones of the approach. One company. And then this solver company then does the co-creation with the challenger. Okay? And then, as I was mentioning before, a supporter, like for example, us as a cluster, we deliver value in terms of business modeling, access to private funding, go to market, any other added value services, any other added value support. Now, usually this process, instead of the 3 years plus, we also usually take between 9 and 12 months. Okay, meaning that usually for this type of approach is things like digital that make a lot of sense. If you want to create a new pharmaceutical component, you don't use this instrument. But for things that are small and they can be quick, this fits very well, which, by the way, it doesn't fit in the PCP. That's why you don't create the project based on the instrument. You have your unmet need, you have your challenge, and then depending on the characteristics of your challenge, then you choose the right instrument. Okay, let's not get perverted from the availability of funding to solve what we want to solve. Okay, the problem chooses the instrument, not the other way around. And we can start that we have done some with funding for the solver from 15,000 euros. Okay, we don't need to get to the millions. 50,000 euros, 60,000 euros is something that regions can afford with, among others, ERDF, and sometimes even with their own resources. Okay, we are getting there with so the starting economical point is relatively affordable. And then, as I said, only one organization, only one phase, very small time, so it is very easy to implement it. Now, in order to put everything together, we have developed this approach in 3 phases. Phase 1 is talking with the ecosystem. This is at regional level, this is relatively new. Of course, this, among others, these PCPs, PPIs, Alliance for Innovation, have been done for a long time at European level or national level. But at regional level, it's kind of new. So you need to start with the capacity building. You need to interact with the ecosystem, make them aware, and explaining the benefits and explaining how things are going to work. That should be the very first step. Okay, then we have the challenge identification, the amended identification. Once you have the first organization that say, yes, I want to play to this game, then you start collecting them, helping them to massage them, to polish them, as we say, from a raw diamond into something that can be understood by the solvers. And then you do the ecosystem connection. Okay, you also start engaging different ecosystems to see how they can complement it. For example, to do the open market consultation, as we said before. Now, phase 2 is operational. Phase 2 is when you implement this instrument. Okay, so here, for example, what we mentioned before, the in-demand project, you launch that instrument, and on top of the money here, we also deliver services. Okay, and for us, very important is phase 3, which is exploitation. In our experience, many times the collaboration, the co-creation between the challenger and the solver works. The challenge is what happens next. What happens after the solution is assessed and says, yes, this solves the unmet need. Okay, because what we see many times is that it doesn't survive the valley of death after the end of the pilot. Okay, and we don't want this to happen. So we propose to support the procurement, adoption, deployment of the solution, to set up a governance. So maybe the people that was managing the innovation co-creation is not the same that has to procure for the solution, to deploy the solutions, for example, if it is a digital solution, to check the legal aspects, to make the budget available. So you need to work on that before the end of the project, so to guarantee that there is a smooth transition between pilot and adoption. Other times, maybe the solution needs to be improved. So for that, you need funding. And it could be private funding, it could be investors, or could be perhaps, depending on the project, public. So what is important, however, what is relevant is that there is an exploitation, that it doesn't go, that it's not wasted, all the effort and all the public money.
Okay, related
Yes.
to this, we have one question, which is,
okay, sure.
in the case of this model and in the real use cases you used it, which stakeholders were the funder?
The funder was the Regional Development Agency. The funder is the one that manages, for example, ERDF money for innovation. In our case, was the Regional Development Agency, but for example, in Oulu, in Finland, it was the town hall, the local government. For example, in Poland, could be the Murcia. There is always, in each region, there is an agency, an organization that manages public money to support innovation. Usually that money goes directly to the companies, to the startups, to the SMEs, to develop what we talked before, the technology push approach, to work also, they give them vouchers, for example, for internationalization of these programs. What we are trying to do here is to convince these agencies to work in a demand-driven approach. That is, taking a percentage of the bag of money that they have to complement their technology push with demand-driven approaches. Not sure if I have mentioned, sorry, if I have solved the question. We have a question from Elena. Let me stop sharing, and can we give the word to Elena?
Unmute. Hi.
Hi, Elena.
My question is, who is actually the challenger, the one who demands the innovation, who sends the need? Because if it is a procurement authority, then it is quite easy afterwards, after the innovation has been generated to procure and get to the market a solution. But I'm not certain this is what you have in mind.
Right. What we have usually work is with healthcare organizations, but a challenger can be anybody who has a challenge. We have also have experiences where big companies or even small companies were playing the role of the challenger. Okay, so it could be healthcare organization, it could be the education department, it can be the police, it can be the army. We have had some experience with them. It could be emergency units. It can be whoever has a challenger that wants to get it solved in collaboration with a third party, which is an innovation company with the right technology and capabilities to do so. Is that clear, Elena?
Yes. And how is this challenger getting in touch with the authority that can procure the innovation?
Well, in principle, that organization has resources to adopt it. So, for example, if you work with a hospital as the challenger, the hospitals is all the time procuring things. They have the budget to do so. They are buying face masks. They are buying medicines. They are buying X-rays. Okay, so the same that they are buying these traditional objects, things, services. What we ask them is that if the unmet need that they have gets solved, say, for example, a digital solution, that after the pilot, they procure for that solution. You know what I mean? They have to have the resources to incorporate it, because otherwise, what's the point of doing that? So very important, and thanks, Elena, for this question. What here is that this instrument is not for, or as least how we see it, is not only to advance science, okay, to increase the TRLs, if you are familiar with the concept. It's not only to move from something that is a technology that is not mature enough to a more mature technology. What we want is that a customer, meaning someone that has the money to procure, puts the solution on the table and commits to procure that solution if that solution works, solving the unmet need that they say they have.
And have you looked at the possibility that there is demand? There is demand by maybe a public or private entity, let's say environmental demand.
Yes.
And this demand is sent to the smart specialization. Now in regions, you have the smart specializations, and you have points that are dealing with the calls for proposals that is sent to them, and then a call is opened that would be that would generate certain proposals for this kind of needs.
Right.
So yeah, to aggregate needs and to use the smart specialization as a means of acquiring innovation.
Right. In this process, the need starts with the organization that is going to buy that solution. Okay, so usually it's more a bottom-up approach. Okay, so you can have directives coming from Europe, from the national organs. You can have a smart specialization strategy that say this area is very strategic for the region. But at the end of the day, because we are dealing with projects that will take, say, 1 year, and that will require 60,000 euros, these projects need to be very concrete, and they have to come from the organization that commits to acquire the solution if the solution works, right? So you can have a smart specialization guidelines within your region, and you can say agriculture is very important. It's priority for our regions. Yes, but who is the organization that states the concrete need that wants to be solved, that has budget, if it works, to procure it? I am solving your question, Elena, or not?
Not really.
So
because
please rephrase.
what you are trying to do is practically the person that actually the public authority that it's in a way a public body that needs innovation, that it publishes its need and then it finds a solution. What I'm trying to see is there a possibility to collect the needs, like with an intermediary body, which could be the smart specialization, contact point, local point,
Right.
to collect all the demands from the different public bodies, say hospitals, you said, community that is dealing with wastewater or whatever other thing that there might be, and on the basis of all these demands, to see, okay, what kind of innovations there could be interesting, and then to open calls for innovation, in the regions under the because we have quite a lot of funding for innovation.
Right.
I'm not so much certain that we
Elena,
have funding for the other stuff.
You can do that. I mean, you can do that. Okay, so directly, instead of the challenger putting that, is kind of an intermediary that identifies what are the needs. But one of the critical steps is the co-creation between the solver and the challenger. Okay, you need to make the collaboration between the customer, the future customer, the ones that is going to incorporate the solutions developed by the solver. You make them collaborate, okay? Because if not, what you have is the technology push. What is that usually happens? You have the needs collected by an intermediate organization or whoever is in charge of doing the regional strategy, and maybe you launch calls, and then these calls are awarded to companies that they develop solutions to solve that need, but maybe they don't do it in collaboration with the potential customer. And then you are in the scenario that it's a technology push, because then that company develops the solution and then it has to sell it to the customer. That is very fine, but it's a technology push approach. Do you know what I mean?
I totally agree with you. The technology push is not so efficient, let's put this way. I used to be before in intellectual property, so the technology push is a very difficult thing.
Right. So, but saying, yes, of course, you can have solutions that they identify at a higher level and maybe share with the ecosystem. But because we care a lot about exploitation, okay, if you don't involve customer and provider in the co-creation, how are you going to exploit it? You need that the customer is part of the process. So if you don't involve the customer in the co-creation, you have a technology push approach, which is fine. It is fine, but then it is not the demand-driven approach we are talking about. The technology push is what we see that is happening now all the time. As I said, our regional development agencies, they have vouchers, they have direct support for innovation projects. It is there. But at the end of the day, all the money goes to the company and the customer is involved at a later stage in the best case. Sometimes it's not even asked. I've done that, right? In my previous life. You go to the cave, you go to your office, you think you understand what is the unmet need, you develop a solution, and then at a later stage of the solution development, then you start or you try to engage with customers, or you develop it and then you try to directly commercialize it. That is fine. That is happening most of the time.
Yeah.
But it's not demand driven.
I agree with you. I agree with you. My point is completely different. My point is that you need to go to all these different entities proactively and ask for their needs, and then to connect innovators with the ones that need. But I know that the problem is also confidentiality in the process. Yeah, you're not going to tell as a big company or as a big hospital or whatever that you need something, because then your shares are going to fall. As well, there are certain sensitivities here. I totally agree with you. My question is, can we do it? Can we do it with many needs identified in a particular area, and then you launch a call for all those needs, and then you connect the right, offer with the right seeker, the person that needs something.
Right. Yes, that's what we are doing. I mean, you say confidentiality, then don't share. But in our experience, there are a lot of needs that share, because think that the challenger has a need, okay? And they say, I want this solved. They are not disclosing any IP. They are saying, I have this problem. And then the co-creation between the solver and challenger is confidential. You don't make it that collaboration public. The solution, then when you finish, then you say, this solution solves this problem, but you are not disclosing anything. The only thing that you disclose here is the need, the problem that you have. For example, I want to improve the connection between the neurologists with the epilepsy patients. There is no IP involved in that. You are just raising your hand and saying, I want to have this problem solved. Okay. You can also say, we do a top-down strategic analysis based on our smart specialization strategy, and we have identified that we have these unmet needs, these challenges. Fair enough. Then you can pass this to the agency, for example, the regional development agency, and say, okay, I'm going to launch calls for getting these strategic regional challenges solved. Fair enough. The question is now, how do you do it? You pay the small and medium enterprises to do it by themselves and then try to sell it? Or you kind of force a co-creation between those small and medium enterprises or startups to co-create the solution with the organization that at the end of the day has to incorporate that solution in order to produce the benefit. If you just give the money to the small and medium enterprises and they develop the solution just by themselves, that for me is technology push. Okay, even if it comes from a solution that is identified at regional level. If you force them to co-create, then there is a co-creation coming from a demand that maybe is not from the challenger, comes from the region. But what is very important for us in this approach is that that organization commits to exploitation, meaning that if the co-creation works, the challenger or this organization that is the end beneficiary commits to incorporate it. Because for us, it's not about increasing the technology levels, it's about solving a problem to the challenger. Okay, so that's how we see it. But of course, if you want to just to increase the TRLs, it's fair enough. The model also works, but then it's not part of the GIA approach. It's more traditionally, I just want to improve science with this approach of the co-creation. Yes, I don't know if I'm answering or not. In any case, we can take it offline. Happy to answer if there are specific questions. Maybe it is me that I haven't understood your question. So very sorry if that's the case.
We have other two questions, so if you would like, we can move on.
Yes, please.
One is from Luis Ferreira, who
Luis?
said,
Yeah.
Jorge, I am curious about the selection process of the potential solver. Sometimes it's useful to have more than one. In this concept process, it would be possible to select more than one and put it working together.
Yes, I mean, obviously, this is a very simplification. The solver could be a consortium of solvers. That's no problem. What we don't do compared to the PCP is to have in parallel different teams trying to solve the same problem. You can have that. This is the model of the pre-commercial procurement. You can have that, but that increases complexity. So depending on the project, on the problem, you should choose one instrument or other, because we are getting to almost the simplest instrument. And then the PCP for me is the more complex. You can have anything in between. You can have just one solver, a consortium of solvers. You can have two solvers working in parallel, as long as the challenger has the capacity to work with both and there is no IP infringement, like Elena was saying. So for me, what is important that you guys understand is the concept of demand-driven, and the concept that the PCP instrument is just an instrument. There can be other instruments like this of in-demand. But of course, depending on the problem, depending on the characteristics of the challenger and the funder, what is important for them, you can design your own instrument according to your needs, according to your capacities, and according to your resources. Have I answered your question, Luis?
Wait, I'm going to let him speak because I think he wants to ask something.
Yes, please. Can you hear me?
Yes.
Yes.
First of all, Jorge, very, very good to see you again. Luis from the Innovation Agency.
Hi, Luis. How are you doing?
Yes, you asked me in part of what I was curious, but my question is very much about the selection process. So in this model, as we have discussed it before, the founder or the agency will select solver.
Right.
My question is, this, of course, it would be a process of an application. They have to evaluate the application, and there is any possibility to have a jury that can look to one or two solvers and put them together to work for this co-creation, from the initiative of bringing the challenger together to this jury and to find, okay, this part of the solution can combine very well with this one, because nobody knows what the proposals of the solvers are. So do you see a possibility to put solvers working together after the call of these challengers?
I see the opportunity. Again, you can design your own instrument. Obviously, the problem with that approach is that both solvers have to agree, because maybe they don't want to share the IP, their commercial secrets. And the problem also is that the money that the funder usually puts on the table is the same. So they will need to split the money. So again, and this brings a complexity also during the co-creation, because now the challenger needs to talk with two solvers and the solvers need to coordinate. But if that is the best for the project, of course you can do it. You know what I mean? The thing here is not, the PCP is very strict in the approach, okay?
I know.
It comes from the commission, it has to be phase 0, 1, 2, 3. Here, just do your own instrument. You know what I mean? We are just giving food for thought. This for me is the simplest, as I said before. PCP is the more complex. Anything in between is possible, depends on your resources, it depends on the project, depends on the people. So if that's good for the project, Go ahead.
Yeah. Okay. Thank you very much. I think you answer my curiosity. Thank you.
Excellent, Luis. Any other questions, Anais?
Yes, we have one last question, which is from Federica. Hello, a question about the in-demand model. How spread is the call for companies? Is it done at EU level or local level in consideration of the small amount? Is in any case suggested to spread the call through cluster and other type of platforms?
Right. Thank you very much for the question. That depends very much of the funder. Okay. So, for example, if the funder is a regional development agency that they have ERDF money, some of the regions say no, it is my ERDF, so only local solvers are eligible. Okay, or not. Depends on the good thing is it depends on what the funder wants. Okay, so again, there is no rigidity in the instrument. If the funder wants to be only regional and that is legally feasible, it will be only regional. For example, in our case, we have leveraged this model with European money. Okay, we do what is called a cascade funding in a coordination and support action. And because the funder at the end of the day is the European Commission, we are obliged that the solver has to be European. It cannot be local. I mean, it cannot be only local. I mean, only local. So it depends on what the funder wants and can do. But again, freedom. It is a model. Just adjust it for what you want. Like the colleagues were asking, is it feasible to work with those solvers in parallel? Of course. Can the supporter, and this is what happens, but we didn't want to make the diagram very complex. How it works is, at the end of the day, is that the supporter not only gives support to the solver, actually, the supporter, in this case us, we give support to the challenger to explain them how this process works, to help them with the identification of needs, to help them with the open market consultation, to help them with the definition of the challenge based on the two. We also supported the funder with the design of the call, also to suggest them that in the jury, as Julius was mentioned before, not only have people from the funder, but you also have people from the challenger in the jury. We help them with the selection criteria, etc., etc. So at the end of the day, a supporter supports all these three, the whole process. Okay. The thing is that for simplification, we just put it this way. The reality is the supporter helps everybody. Actually, not even in this loop, but at a higher level, at an initial level, we just say, guys, this is of interest. Let's set up a mechanism like this approach, where the instrument is only in the middle, but we need to have capacity building, actually advocation for this model, for the funder especially, for this to be deployed. So support their organizations, different, it can be a foundation, it can be a cluster, it can be a technological center. Usually, at least in our case, are critical for this to be started and for this to run smoothly. Again, I don't know if I have answered your question. Maybe we can give the word to her. Did I answer your question? Would you like to, Federica, would you like to comment? Federica, I think we can hear you now. Maybe the mic is, let's do that something. I will follow up. Anais, please contact her and we will retake her question, or if it was answered, just let us know by the chat, Federica. Okay. I will follow up on this, on my presentation now.
Okay, then I think we have the last question.
There was another question. Esther.
Yes. By Pau, is the procurement and implementation of the resulting solution contemplated at the end of this process? If so, how is it done?
Right. Thank you very much. Very relevant. Very, very relevant. So Usually with public money only does the co-creation, okay? It doesn't pay for the deployment. The deployment is expected to be done either by, there are three ways to exploit it, and none of them are included in the budget for the co-creation, okay? So one way to exploit is that the challenger acquires the solution with their own resources, okay? Either there is an agreement and then the solver, for whatever the reason, say, here, you can use it, okay? We exchange value instead of money. What you do, for example, is you help me to promote to other potential customers. Because we have received some money for the co-creation, I leave it to you because what is important for me is a first customer reference. I want you to use it so I can go to other potential customers and say, hey, this organization is already using it. Do you want to go and see how they are using it, how good it is? So for some companies, that is very valuable. I would say for all of them, because if the organization you have worked with, the challenger that you have worked with, they don't acquire the solution, then the solver has no market credibility, okay? Because then the potential customers say, so you are telling me that your solution is great? So if it is so great, why the challenger didn't acquire it, okay? So they lose face. It's even actually counterproductive. So the first, well, there can be many, but the first one is that the challenger, and that's the ideal one, because it finishes in a TRL9, the challenger acquires the solution with their own resources. Second option is that you say, maybe the TRL is not 9, it's not market ready, the solution. I'm going to ask for private funding to make the solution market ready and start the commercialization. So they go to, depending on the project, venture capital, seed investment, and they get more gasoline to sell it, to mature the solution, for example, or to commercialize to others. And the other option is that, for example, the TRL is low, and then you think, okay, I need extra public funding to make it market ready or make it bigger in scope, whatever. So what happens is that what I showed you before, this model doesn't cover the exploitation part, usually. I mean, most of the times, because they say, okay, public money goes to say, I just tested the innovation, I reduced the risk, especially in the case in demand-driven. You told me that you have this problem and you were interested in getting solved. Now, what you told me, make it a reality with your own resources. But I don't know if I have solved your question.
Yes, I think so. And there are no other questions right now.
Right.
So
I have just realized that I'm very bad on time. So but for me, it's very important what you have to ask. So please keep on doing that. I'm just going to speed a little bit. So just very important that the important thing is not the pilot. The important thing is these benefits, okay? That you change the mindset of public entities towards innovation, that you create business opportunities, that you put in value the ecosystem, and at the end of the day, because you have these investment policies in innovation, they deliver more value for each euro that is spent in them. So gear to deployment, I'm going to be very quick. This is the initial life cycle. What we have identified is that for adoption, you need anticipation. So these things in greens are actions that you can take from the very beginning. So to answering Pau's question, say, how is that incorporated at the end? Well, you have, for example, a champion in the board of your organization that says, yes, I'm going to help you when the time is right to put the money available. I'm going to, and then you ask, okay, is the management committed? So for example, in one of our projects, we asked for a letter of commitment, okay? Or we staffed the jury and we made a financial provision to buy the solution. Now, prepare, we are these regions, it has been 1 year, we have produced several resources. And for example, someone that I wanted to share with you is that we have made a library of resources regarding innovation adoption, innovation procurement, etc. This is ready here in Prepare. But because Prepare is finishing this year, what we have done from Tipiomed, it was we have taken over, and this will be exploited after the project end. Prepare is finished, but from Tipiomed, we are leveraging the same technology, and this will be open forever, as long as Tipiomed pays for it, which is, for us, is very strategic. So this is an example of phase 3, which is exploitation, okay? And this is what we are going to do because we believe in our own system. Now, we are getting into the recommendation part, things that we have learned during the development of the project. As you can see, there is a lot of work already done. So you don't need to start. We are going to deliver resources. In this library, you will see a lot of documents, videos, reports. You can access them, okay? So start from giant shoulders, as they say, okay? Always to thinking in how you can localize that expertise to your own region with your own specificities. For example, you have given me examples of things that could happen. Can be two companies that are merged together, that they force or they are encouraged to work together after the instrument. Of course, just do it. This is just a sample. They are just practices. Adapt them to your reality. For example, what it was mentioned before about the smart specialization. This is cross-cutting, okay? Just focus on what is your strengths and don't just because, for example, say in Murcia, we focus on health, you think, oh, this is only available for health, okay? Engage regional knowledge and expertise is fundamental. This phase 1 of the GIA approach. You have to involve the different stakeholders from the demand, from the offer. You have to generate trust in the system, okay? And then open innovation. We have mentioned before there is a lot of technology push, which is fine, very fine, but the more open innovation, but open innovation also has benefits, right? So we suggest that you explore that at the level of the regional level, the people in charge of deployment innovation policies to explore demand-driven. Now, this is more for policymakers. What, especially this is a European project at European level that they put more funding into this type of instruments for co-creation, cascade fundings. For example, we have this InnoBuyer, was a coordination and support action. Make the innovation procurement demand-driven. You know that they are very close related instruments. Reduce the legal and regulatory barriers, okay? Make them easier to have a smooth transition between the pilot and the acquisition. Also consider high risk, high reward innovation projects. They can perfectly be supported with a model like in-demand. Again, think beyond PCP and PPIs. Again, these are recommendations for the European Commission, and very important, capacity building at the regional level. Okay. Now, good news for the say, oh, but it's going to take a loan and it's going to take time to get money to implement this kind of in-demand instrument. We have good news from you. We have just been awarded this Innovat project that it will follow a very similar approach. It's paid by the European Commission. Okay, basically the European Commission pays for the pilot execution because it's the European Innovation Council that is funding the InnoMatch project. Only European Innovation European Innovation Council companies can be the solvers. But if you identify a challenger, they can get into the process, but they don't get any money. Okay, the rules are not dictated by Tipiomed; they are dictated by the European Commission. Having said that, be ready, subscribe, go to innomatchproject.eu and register in the mailing list, or register in the Tipiomed mailing list, and you will be aware. We will let you know with the call is launched. We expect it to be in the early 2025, in January or February. So stay tuned. And the same, if you're a healthcare organization, we have a coaching service under the InnoSupport project. help you with this process. And this is it. This is the end of the presentation. I think we have a question, Anais. Is that correct?
It's just a comment that someone has sent another link with a text that, although not directly related to the health sector, the EU Protect project and soon PCP-wise provides resources and highlights what Jorge is mentioning regarding learning from others.
Protect project. Oh, okay. Fantastic. So we will share it also as part of our dissemination. Thank you very much, Mark, for pointing it out. So as you can see, there is a lot of support for demand-driven more and more. Innovation procurement, which is what is usually called to these models at European level, is going to grow in the coming years. This has been proposed by the Draghi report, the A2 report. So it's an area that is going to be more funding available, especially at European level. So please stay tuned because there are going to be opportunities. We have mentioned two, InnoSupport and InnoMatch, and Mark has incorporated also this. We will make sure that we share that, Anais, these opportunities. And of course, we are going to share the presentation. And we are 7 minutes above time, but I think if there is one question, two questions, we still get them. Are there any further questions? Probably
No
people have
further
jumped to
questions.
other meetings. So I thank you for your time. Again, we will share the information. Please follow us as TPOMed or InnoSupport or InnoMatch if you are interested in this project, and we are happy to help. Okay, so I strongly recommend to have a look to the resources, to the library that we have mentioned. Okay, if you want to know more in terms of reports, and if you have a specific question, you can contact us by email, for example. All right. So I think this is it, Anais. I don't know if you want to close with some indications.
So thank you so much all for joining, and we will send our following email with all the useful links, including the presentation and the webinar recording.
Thanks to all.
Thanks, everybody.
Bye.